Hey, welcome to another episode of Your Health and Faith Community. I'm your host, Pastor Jackie Jackson. And as always, on behalf of myself and our producer, Anita Alexander, we want to thank you very much for taking time out of your day to spend with us. Now, you know, before I jump into anything, one of the first things I'm going to do is I'm going to talk about healthcare. I need to know, have you enrolled since the last time we've seen each other, which has been a while? So you know that if you have an income of $16,228 a year or less, that makes you eligible for Medicaid. That means it's going to cover your dental, your medical, even your vision, and that's important for someone like me. It's going to cover emergency rooms, doctor's visits, prescriptions. So if you are a family of four and your income is $44,550 a year, that makes your entire family eligible for Medicaid. And in fact, if you try to go to the marketplace, it will send you back because they're saying there's no need of you putting yourself in financial jeopardy by paying too much for health care. Now, if you don't fall within those guidelines, you want to go to www.healthcare.gov. You can't go now, but write it down so when the time comes, you can do it. That's when you will go into the marketplace and start shopping for health care. Listen, I've told this story. I'm going to say it again. In 2013, I went to the hospital with congestive heart failure. I came out after a week with an $80,000 medical bill, and I was not insured. So if anybody wants to help me cover that, you can send money to the studio. That would be great. But you don't need that. One of the leading causes for bankruptcy in this country is actually medical bills. In fact, it's like right at the #1 cause. So don't put your family in that position. Don't put yourself in that position. And that last thing, I know some of you young people are saying, well, look, I'm young, I don't need health care. All you need to be doing is going up for the jump shot, come down wrong on your ankle, and now you've got this bill, and it's really gonna hit your pocket. So get insured. I'm gonna leave you alone until the next time. Listen, I'm very, very honored today that we have with us Dr. I like saying that, Dr. Vanessa Enoch, PhD, MBA. And what really I like about it is that this is a young black woman, and I love to see our young sisters achieve that type of educational level that I may never get, but I live vicariously through her. Thank you very much, Dr. Vanessa, for being here.
Thank you, Pastor Jackie, for having me.
How are you doing?
I'm good. I'm doing really good.
Great.
And I got my health care insurance, so I'm good.
Thanks. So now I can't even pick with you. I was going to ask you. You just messed up the whole. Thank you very much for joining us. No. We're here today to talk because you have a very impressive bio, and I want to go through all of it, but I just want to jump into something that's real important when we look at what's going on in our country today, especially around gun violence. And just here in our city, 92% of the shootings or homicides in this city, or 92% of the shootings in this city, have been black men. And of the 92%, 96% of the shooters have been black men. So not only do we have an epidemic going on in our city that's involving gun violence, that means that there has got to be an epidemic going on around trauma, because there's no way we can have this much shooting in these communities and not have trauma. Whether if it's a homicide, then you've got a mother, you've got brothers and sisters, children who are dealing with that. Or the people in the community that's there that saw it. You can say it doesn't bother me, but somewhere in the middle of the night, somewhere in your classroom, on your job, it's going to be able to creep in. So trauma is really big right now, especially gun violence, but not just related to gun violence, domestic violence, sexual abuse. There is so much trauma. And what you're doing is you're the director of the Cincinnati Trauma Center, which is a new, I don't want to say idea. Well, actually, kind of. It is a new initiative, but it's a new idea.
Yes,
it's cutting edge. So why don't you tell us what this center is?
You know, and you're absolutely right. It's cutting edge. Our trauma centers here in Cincinnati, which are in Winton Hills and Westwood, we are trauma centers, let me just first of all say, without walls. We don't have physical structures. Our objective is to be in the community, working with people in the community. And in particular, we are working with young people. We're working with children who have been either victims or witnesses of abuse, because we know that the impact of trauma happens to people on various levels. It happens that it impacts people whether you are a witness to that trauma or you have experienced trauma yourself. This is a community-driven effort, first and foremost, and we are treating young people who, first of all, we're screening to see what extent trauma has impacted the communities. The two communities that we're working in are Westwood and Winton Hills areas. And we are, first of all, screening young people to determine the level of trauma that they've experienced. The same way we know that PTSD has impacted soldiers in the military field because of their exposure to so much violence. The same kind of exposure right here in neighborhoods, we also know is happening to our children. And as a result of that trauma, what we know as well is that trauma rewires a child's brain. And the good news is that the brain can be rewired. Children are adaptable, they're resilient, and they can come back from trauma. However, until they've been screened and you've now determined to what level they've been impacted, you don't know how to treat that child. And so what we're doing first and foremost is we're screening children in those communities, and it is a self-referral. Parents can refer a child, or people in the community can refer a child. And so we are partnering with several organizations. We first of all came together with people in the community to talk about what are the issues, what are the problems. So the ideas really came from people in the communities who said, here's what we're experiencing. We don't have treatment. We don't have people when there is a shooting in the neighborhood, and all of the various organizations in some neighborhoods come together and they'll have trauma services at the school and in the community. What we found is that that's not happening in the inner city. And the kids in the inner city are the ones who need those kinds of services more. And so what we're doing is working with organizations that have who touch children in some way, whether individuals and organizations, whether it be counselors in schools, rec centers, teachers, community organizations, hospitals, organizations like the Cincinnati Initiative to Reduce Violence, the Pivot Program. All of these organizations come in contact with children, pastors of churches, and children who have been traumatized. They're seeing the impact of trauma, but they don't recognize it.
Well, let me ask you this before we go, because, and I probably should have did this at first. Trauma, not a new word,
absolutely,
but a new word, right?
Yes.
So I don't want to call it the catchphrase of the day, but especially in the Black community, gun violence, domestic violence, and we're not saying it doesn't happen in any other communities, but talking about the Black communities now, that's been going on for years and years and years.
Absolutely.
Long before we were using the word trauma.
Yes.
So just for edification, what is trauma? Because sometimes if we don't know the word, then in our mind it doesn't apply. It doesn't apply to me because I don't really know what that is.
Absolutely. And trauma can occur in a number of different ways. And I'm going to talk about it really on a surface level because I'm not a psychologist. My doctorate degree is not in that field. My degree is really in public policy and in interdisciplinary studies. So what I look at is the complexity of what happens to people, social change, the aspects of social change. And so we're talking about, on an individual level, what happens to you when you've experienced things like gun violence, or you've been sexually assaulted or molested, or various other kinds of things. You've lost a parent, or when I talk about losing a parent, it could be losing a parent through violence or divorce, or various other, or an individual who has cared for you. And so what happens to you when you experience those kinds of things, it can happen on various levels. You experience the pain of that experience, you experience some after effects. And so oftentimes you'll find that when kids are experiencing violence on a day-to-day basis, they see that as the only way to solve problems and to interact. You know, the brain begins to go into survival mode. And so what survival mode looks like to you and what it might look like to somebody else may be different. And so that's why we're assessing how has trauma and those kinds of negative impacts, how has it impacted the children in communities? Because if those children are experiencing these things on a day-to-day basis, these negative occurrences on a day-to-day basis, we know that it does have an impact on the way that they learn, the way that they cope, the way that they experience normal things like going to school or even caring for themselves. They take on behaviors that may not be conducive to a healthy mindset or healthy attitudes. And so what we want to do is make sure that we work with people in the community, work with children to help them understand what has happened to them as a result of these negative experiences and help them get to a healthy place in terms of how they communicate and how they adapt to things that have happened to them. And so not only are we working with children, we're also working with families, with parents who have to care for children. We're working with educators who interact with kids on a day-to-day basis, with community centers, wherever a child might have experiences in the community, with coaches.
Which takes me to that the question, because I know, I mean, obviously I'm aware that the program is, a lot of it will look on the surface like probably every other trauma program going on. But then it takes an interesting curve.
Yes.
And that interesting curve is dealing with the community, right?
Yes.
Because as a parent or as the parent of at the house where the kids come to hang out, being able to recognize that there may be a traumatic experience. And if you know that the child has seen violence or experienced violence, you know there's some trauma going on. But what is this interesting turn that separates, I think, where we say we're all the trauma programs are running together in a line, and then all of a sudden the Cincinnati Center goes,
Yep,
what
absolutely.
What is that?
Because we're not just treating the child. It's sort of like treating a cold. You know, if you catch a cold and you come into your household, everybody in that household is subject to catch that cold. If you treat everybody in the household, then when that child is in the household and everybody else is well, that child's not going to come into that household and, you know, reinfect everything and everybody, and they're not going to be reinfected. So what we're doing is we are training parents, we're training family members, caregivers to be able to recognize those symptoms and to help that child to build healthier relationships with that child. We are training people in what's called CARE, which is Caring Adult Relationship Enhancement. And we have foremost experts right here in Cincinnati at Children's Hospital and University of Cincinnati who do these trainings across the country. They are trainers, people in the community who are going to be working with the children in the community to understand the signs, to be able to better communicate with their children, better communicate with the children they work with. That's the difference.
But also, it's because you mentioned the community centers.
Yes.
But we're also talking about that trusted source in the community.
Absolutely.
And that trusted source may be a grandmother. It may be, like I said, the mother or the father, mother and father of a particular house that children hang at.
Yes.
So it's not just saying, I'm going to train you to look at your child.
Yes, it's any child in that community that they may come in contact with. They'll be able to recognize the signs and to be able to better relate to that child because they know now how to talk to a child who has experienced trauma. We're also training those individuals in the communities to lead groups, to help children, like at the rec centers. We had a training this past week, a 2-day training, and we're training people in the rec centers where kids are spending a lot of their time. We're training police officers to recognize trauma so that they too can engage better in those communities with those children around issues that they recognize.
But there will be mental health professionals
Absolutely.
as well. So it's not,
Yes.
so it's not just the community saying that Tim down the street is going to all of a sudden become my son's counselor. There will be professionals
in
to actually
in that
view
same group with people who that child knows and who that child trusts. It'll be those individuals who they see on a day-to-day basis who will be in those groups interacting with those children with a trained clinician to be able to help those children understand how to, navigate spaces. But they'll be in there, they'll know that child's story. They'll be able to say, well, what about what you told me last week? You shared with me last week, da-da-da-da-da. And they'll be able to engage. They'll hear from the friends because they're also seeing their friends in those same centers. So that's one of the areas where we are different from other trauma-focused treatment. And in fact, we also are offering treatment to children by clinicians. We're working with organizations like the Children's Home of Cincinnati to offer treatment, direct treatment for children who have been victims of various kinds of trauma. With regard to sexual trauma, especially, Children's Home will work with children. But we also have other clinicians who are accustomed to working with children who have similar backgrounds as children in the communities that we're working in, who are going to be providing direct service treatment as well, individual treatment. So we have individual and group treatment, and we also have the training that we're doing for the overall community to help them understand the signs and symptoms.
And now here's an important question. Mm-hmm. How bad is this going to hit my pocket? And what if I can't afford this? Because it sounds expensive. It sounds like, there's a lot going on here. So it sounds like a lot of money.
Yeah, absolutely. And you're right, ordinarily. In this particular case, we do have a grant we actually have 2 grants that we're running this program under. We're running it under a violence prevention grant, a VOCA grant, as well as a matching funds from the Cincinnati Police Department. And so these services to people in the community are absolutely free of cost.
So I don't even need to bring my insurance card or my Medicaid card?
None of that. None of that.
Okay.
Yep, the services are free to children. And what we are encouraging people to do is, if you know that your child is experiencing things. My daughter lost her father. My husband passed away about 11 years ago. And I saw the signs and symptoms, but as a parent, you don't know what to do to help your child. We have spoken with children in junior high and high school who have shared with us, I don't know how to communicate with my parents. I don't know how to tell them what I'm going through. But here's some of my experiences. Kids who have shared suicidal thoughts as a result of some traumatic experience that they've had, and they're looking to cope. So we're saying to parents, contact us early because we do have a limited number of slots for treatment. We can screen, numerous children at this point, but we're hoping to be able to secure more funding so that we can work in different neighborhoods. We're hoping to be able to expand our services to Price Hill. We have put in 1 application for that, but our funding sources have not grown. They're not growing even with asking, can we expand our services to Price Hill? So right now we're in Westwood and Winton Hills. So if you have a child that is either going to school in those areas or who is in church in those areas, but in those communities, or who lives especially in those areas, that's where our funding can cover right now. Hopefully with time as we grow, we can bring other neighborhoods.
Time and success, definitely.
Absolutely.
So I know that with the center, but I don't know if I'm using the right term. Is it partnership with the community outreach advocates? And yes. I know that you and Rashid are working very closely.
Yes.
Have been since the beginning
yes.
of this,
yes.
getting it going.
Yeah. Yes. And Rashid is with Cincinnati Initiative to Reduce Violence, an organization that you're also associated with. But we also have a number of partners such as Dr. Victor Garcia, who is a renowned pediatric surgeon here in Cincinnati, who's driving this effort. As I mentioned before, people in the community have been at the table in both of those communities to help us. This grant actually is a grant that was received by the Cincinnati Islamic Community Center. We're also partnering with the University of, with some individuals, Dr. Barbara Boat and Dr. Erna Olafson, who is doing much of our training. I already mentioned the Children's Home of Cincinnati. We're also partnering with the police department, with the schools, some of the schools in the communities that I mentioned, and various other pivot program. And that is the place-based violence initiative that is also operating in those communities. And I mean, there are various organizations that's working with us. The health department is also working with us on this initiative. Children's Hospital will be looking at the data to help us kind of evaluate the impact of trauma on those neighborhoods so that we'll know going forward what kinds of things people in the neighborhood needs. Now, this project is not just about the treatment services that we talked about. We are also looking at expanding the program to include things like entrepreneurship and things that will help children. We're meeting with and talking with the Cincinnati Fire Department, the police department, paramedics, to talk about other initiatives to train young people so that they'll be prepared for careers and job opportunities. We also want to train them and prepare them for entrepreneurial opportunities. We want to make sure that as we treat the community, the entire community, that we are building collective efficacy and social capital so that people in communities are empowered in the future. We want to make sure that when we finish treating the community, that we have holistically dealt with various issues, all of the areas of complexity. In fact, I will be flying out to California next week to meet with a school that has built into their school system some of the capacity that we're looking to build in communities here. So we are bringing together some of the best ideas, the best minds in the country to impact 2 communities here in Cincinnati, and we're bringing the entire community together, including the residents, to figure this out.
So this isn't just a program that a couple of people got together and said, hey, let's do something. I mean, this is coming with the medical data, the background, with the professionals who have spent years, years of working on this and studies and working with individuals. And that is something that makes it also really important. I think that people know that this is not just a program. This is coming with a lot of weight under it that's supporting it.
And let me tell you, actually, it did derive from a couple of people coming together in the community to say, we want to do something about the problem in our community. In fact, what happened and what actually drove this is an individual was shot, a father was shot outside of a school in Winton Terrace. Mm-hmm. And when that father was shot, they came out to investigate the scene and the body wasn't covered. And children getting out of the elementary school walked by that body and saw that body laying on the street, and those children were torn up because they knew the father of the child. And not only that, the child whose father had been shot was actually coming out of that school too, because the information was not able to get to them in time. And so what we wanted to do immediately when we heard was figure out, how do we deal with the problem of making sure that those bodies are covered and that those children, that you minimize the impact. And then as we began to talk with those community members, we learned that it's much deeper than just covering a body in a community. The problem is much deeper. We want to make sure that we're working with kids around the psyche and what happens to them as a result of community violence, because we realize the complexity of the problem. And it doesn't just start with the individuals who are impacted by the violence, but the violence itself. Where is it coming from? What's it stemming from? And that's what we want to understand. That's what we come together with various professional community organizations, as well as individuals who are living the experience. This isn't about bringing a bunch of people who have studied violence and they're reading it in a textbook. This is about working directly hand in hand with community members who are saying, here's what we're dealing with, here's what we see, here's how our children are impacted, what can we do about it?
Well, what I meant by when I said it, that, yeah, I understand it started with a couple of
Absolutely,
people. But
yes.
now that it's getting ready to be implemented,
Yes.
it now comes with a lot of weight.
Yes,
that's
absolutely.
coming with it.
Yes.
A question I want to make sure, because we're running out of time, I want to ask about, and I hate that I even need to ask the question, but I want to. In a lot of communities now, and even in a black community, there are still Latinos in a lot of the black communities. And we know that there is a fear to come out and get help. I know when I was with Enroll America, that one of the issues we had was that didn't want to come get help out of fear of something happening. And I don't want to go into a political side of it,
Yes.
but just saying that if they're in the community, in one of these communities, this is for them as well, and they need to come out. And you need to come out without fear. This is not a program that when you come in, it's going to be like, we need to see who you are. We want to know that
not.
you are
Right.
safe and your kids are healthy, and everybody's progressing the way that they need to.
And the benefit of engaging the medical community in this is that we are preserving the confidentiality of the children and the families who get services. This isn't a program where we're going to be reporting back who those individuals are who are experiencing the traumas. Now, I will say that when a child is negatively impacted, that certain professionals are mandated to report certain kinds of things. We are making sure that our objective is to keep families connected, to keep families together. We want to protect children. And so whatever it takes to protect a child, that is what we're doing. But in terms of the, ICE coming in and saying, okay, let's grab let's tear these families apart, that's not going to happen through our program, because that's not what we're about. What we're about is healing communities and those children in those communities. And so, no, they don't have to worry. We are welcoming people from the community, no matter what race, no matter what age, children from, preschool to high school. We're equipped to work with those children. Any child who has experienced those traumas, whether they be Hispanic, African American, white children, we don't care.
But it's not going to be a hideaway. If something's going on with these children that is negatively impacting, and they need to be protected, you need to know that you are not going to come in, and it's like, oh, shh.
Yes.
It's
no,
not it's going to get
none
the
of
kids
that.
healthy.
We are going to do what needs to be done to get those kids healthy. We're working hand in hand with the families, and our number one priority is to protect children and to heal those children and those families and those communities.
Well, Dr. Vanessa Enoch, I appreciate you coming out. Definitely a program that I hope everyone takes advantage of. In fact, I hope it's so overwhelming that you have to go out and just try to find some more people to come in like immediately. And listen, we want to thank you again for coming out, turning on, engaging with us. Prayerfully, you heard some information that will be life-changing. We're going to have information up on how to contact Dr. Enoch. You need to reach out to her. If you're being impacted, your children, your family are being impacted, you need to reach out and find out right away, how do you get involved in this particular program? It's coming your way, Winton Hills and Westwood. Come on, get on board. That way you can stay healthy and faithful. Until next time, God bless you.